Should I turn off?
No, you're fine.
Just leave it. Okay.
Okay, perfect. Good afternoon and welcome. My name is Gabriel Ronquillo. I'm the Congressional Hispanic Leadership Institute's Programs Manager. Before we start today's discussion, I just have a couple of things to discuss. We ask that you help share the speaker's point of views and share yours as well. So please go ahead and follow us on Instagram and X at the CHLI. And after the panel discussion, there will be a time for Q&A. So we'll go ahead and get those questions ready towards the end of the discussion. We will be including this live stream, so if you follow us on YouTube, we will post this after we conclude it. So go ahead and follow us at the CHLI on YouTube as well. So now to kick off the program, I'll go ahead and pass it on to our CHLI President and CEO, Mary Ann Gomez-Horta.
Buenas tardes, welcome everyone. Thank you, Gabriel, appreciate it. To get us started here, just a reminder of a couple things is the mission of the organization, the Congressional Hispanic Leadership Institute, is the premier organization founded by members of Congress to advance the Hispanic community's economic progress with a focus on social responsibility and global competitiveness. Founded in 2003, CHLI is a 501c3 nonprofit. We're also the only bicameral, bipartisan, Hispanic-led and Hispanic-serving nonprofit here in Washington, D.C. We're dedicated to fostering a broad awareness of the diversity of thought, heritage, interests, and views of Americans of Hispanic and Portuguese heritage. I would also like to take this time to thank our sponsors, some who are here joining us on the stage here on the panel discussion. The sponsors are recognized as year-round sponsors of the whole briefing series. We hold one briefing per quarter. So if you have not had a chance to participate in some of our other briefings, we look forward to your engagement and participation next year. Our sponsors for this year's series are Accenture, Amazon, AstraZeneca, Capital One, Chevron, Dominion Energy, Eli Lilly, Halion, Hispanic Access Foundation, and Prometrics. A round of applause for our sponsors. Thank you. Also, as you all know, none of these discussions, in person and virtual, are possible without an awesome crew. I want to thank the team at CHLI, Gabriel, Angela, Nicole, Tia, Emily, Bruce, Andres, Sofia, Maya, Elizabeth, and Paola. Thank you. The Congressional Public Policy Hill Briefing Series provides a platform for an in-depth dialogue on current public policy issues that affect us, the U.S. Hispanic and Portuguese communities. These are briefings to educate and inform members of Congress, their staff, and the Hispanic communities across the country. Today we will be discussing healthcare in the Hispanic and Latino communities, and I would like to introduce our moderator, Jeanette Contreras. Jeanette recently founded the Latina Health Collab, a boutique consulting firm focused on improving health outcomes in the Hispanic community. Most folks knows her as Jet. She has held leadership roles in prominent national nonprofit organizations and spent over a decade in public service at the U.S. Department of Health and Human Services. She also serves on the board of directors for the Society of Hispanic Rare Diseases and Mom Congress. I love that when I saw that. So join me in welcoming Jeanette, and then she'll take the floor from here and introduce the rest of the panelists. Thank you, Jeanette.
Thank you, Marianne. And thank you, everyone, for joining us today to join this great discussion on advancing public health. I'm going to lay out a little bit of sort of like the theme of what we're going to talk about today. So within the Hispanic community, advancing public health involves a multifaceted approach that employs both individual systems and systems to achieve better health outcomes. At the individual level, education and resources are key to fostering personal responsibility for health and for encouraging proactive behaviors such as regular exercise, balanced nutrition, and preventative care. At the systems level, it is crucial that the public health initiatives recognize cultural values and access barriers specific to the Hispanic community. So simultaneously, we needed to focus on strengthening public health systems through policy, advocacy, and community engagement. This multifaceted focus not only enhances individual health literacy, but also creates a robust infrastructure that supports the overall community well-being. So now I'd like to introduce the panelists and actually invite them to each introduce themselves briefly. So we'll have each of them do a brief introduction, and then I'll begin to kick off the panel by asking a few specific questions to each of the panelists. And then we will have time allotted at the end for questions from the audience. So with that, I think we'll begin with Dr. Karstens.
Oh, okay.
Yeah.
Hi.
Actually, no, I probably should. I was going to go this way over and I said this way up. Okay, Jonathan, let's go.
That's fine with me. Is this on? I don't know if this is on.
Is that on?
Is it on?
Can't hear you.
Yep.
You have to click.
Look at it.
Yeah, I don't trust myself to break it. So good afternoon, everybody. Jonathan Martinez, you can call me John. I'm the head of federal affairs at Haleon. You probably don't know who we are. We are the manufacturers of Advil, Sensodyne, Flonase, Tums. We're somewhere, probably in your book bag. But formerly, we were a pharmaceutical company known by GlaxoSmithKline. We demerged in 2022 to become our own spin-off, focusing exclusively on over-the-counter products. And our goal has always been to meet patients where they're at, even if that's at the over-the-counter aisle. So we are proud of our pharma legacy, and we are also delighted to be able to adapt ourselves to our consumers' needs.
Buenos dias. Good afternoon. My name is Guadalupe Pacheco, and just real briefly, I used to work at the Office of Minority Health from 95 to 2013, so I dealt a lot with health disparities affecting minority populations. But currently, I'm doing a part-time gig with the National Hispanic Health Foundation, and we focus on leadership, research, and education. And those are three important pillars, I think, that are so important to empowering our Hispanic community. So happy to be here and look forward to the discussion.
Leaves me. Hello, everybody. I think I would say buenas tardes, maybe, or unless it's a little too early for that. So I don't speak Spanish, sorry. My name is Donna Karstens. I am a pulmonologist, and I am the Senior Medical Director for Respiratory Biologics at AstraZeneca. I'm here partly because everyone at AZ knows that I am very passionate about inclusion and diversity, and certainly health disparities is significant and important to address. So I'd like to think that my presence here is going to help shed some light on some of the prevalence of disease and how we at AstraZeneca are making a difference in improving outcomes for patients with respiratory disease.
Great, thank you, that's perfect. Well, what an esteemed panel we have today. So we're gonna get started by asking the first question to Jonathan, but I'd also encourage the other panelists to go ahead and feel free to chime in on all of these. We'll start with a big question. So what is the biggest challenge in healthcare at the moment, Jonathan?
So I think the biggest challenge is making sure that there's patient-centered care. And that is a big problem here in the United States. We recently partnered with The Economist to roll out something called the Health Inclusivity Index. And what that does is provide an analysis of about 40 countries worldwide, and it gives you a little snapshot of where things are in those respective countries. What do they do well? What could they do better? And it's based on three pillars. The first, the everyday experience you have while accessing healthcare. The second is just the actual point of access, right? Does that access meet your actual needs? And then thirdly, a community empowerment portion in which we look at whether or not patients are empowered where they seek care. And we are now in our third year of doing it, and unfortunately, the United States has spends a lot of money on healthcare. Yet it falls 11th on that ranking on ensuring positive health outcomes. So still a lot of work to do, especially in our case where we're looking at really trying to make sure that there are accessible and affordable healthcare products over the counter. And so, like I said, there's a lot of work to be done, and we hope that the index that we've developed helps inform some of those conversations as we look at, programs like, Medicaid, Medicare, but also thinking about those other, buckets of folks that don't qualify for those programs, right? Sometimes you could, have that need, but by 50 cents, you don't qualify for Medicaid. What about those families, right? So there's a real conversation we have to have about making sure that that safety net just doesn't think about the current programs, but looking at how we expand our definition and understanding of healthcare.
Thank you. And so I think the next question really does a good job of piggybacking off of that for Dr. Karsten. So can you tell us what AstraZeneca is doing to address the needs of the Hispanic population?
Yeah, so I think one of the most important things to share with you is that we have a really dedicated focus on health equity. One of the things, well, there are a number of things, but we have a program called Act on Health Equity. And within that, we have several different ways that we are engaging with different communities, the Hispanic community specifically through our Community Solutions program. Every year we fund 40, I think it may be up to 50 actually, $25,000 grants for community projects that are specifically geared to improving the health and quality and outcomes in communities, whether they be Hispanic, Black, or other, underserved. And so very proud of that. But one of the things that's really most important, and I think it highlights what Jonathan was saying, is, it's great to have programs, but people have to recognize and identify themselves as having a health issue. And so, working on making sure that there are tools out there, there's awareness about disease and about the outcomes of untreated disease. And so that's really particularly important. One of the other things we're doing through our medical science liaisons who are out communicating with physicians is talking about the appropriate guideline-directed care. So if you are unfortunately treating patients who may not have commercial insurance with rounds and rounds and rounds of steroids, prednisone, we all know, probably have heard of prednisone, which basically has terrible outcomes in terms of increasing risk of hypertension, diabetes, obesity, cataract formation, cardiovascular disease. So one of our goals is to try to make sure that people, clinicians and patients, are aware of the ravages of those treatments that are being used because they're cheap. And instead making sure that there is access and awareness of appropriate therapies that are accessible, and we do our best to make those accessible to all patients, where they can actually achieve better control and less of the consequences of medications that are dangerous to them or deleterious to their health. Another thing that's actually unique to AstraZeneca, and tell me if I'm speaking too long, but I could go on, is we have a program or a vision called Ambition 2030. And among that is a goal to reduce our carbon emissions. So by the end of next year, we have and are on target to reduce our property emissions by 96%. By the end of 2030, our goal is to have decreased 50% emissions across our entire operation. And something you probably don't know is that inhalers, people think of those rescue inhalers that we have, they actually are quite deleterious to the environment, to the ozone layer, etc. And so what we have done and actually have filed already to do is have a next generation propellant that is safer for the environment to help reduce our impact on the climate change that goes with using those that are not the right generation. So again, just really many levels in which we are making an impact.
Yeah, that's wonderful. It's amazing what we've learned, right? We know that aerosols are bad, right?
Yeah.
We used to do hairspray back in the day. Now we have to stay away from aerosols all over. And so let's turn to Guadalupe. You have an extensive background from working at the U.S. Department of Health and Human Services in the Office of Minority Health. And I'm sure you've seen some great models for best practices. So can you tell us about some effective strategies for empowering Latino individuals to take charge for their health?
Sure. First of all, I just want to make some comments about both of my colleagues here. And in terms of I have three children, 2 boys and a daughter, and my daughter and oldest son were asthmatic. So I understand from a personal parenting kind of perspective, the challenges that Latino children, families, and other minorities face when their child has asthma. Because a lot of times it's about health insurance, access to health care, access to a primary care provider. So if you think of, when you look at Latinos, what maybe 25% only have health insurance. So there's a big gap there. So we're talking about access to health care. That's important because if you have access to health care, then you may have access to quality health care. But that's a big question as well. If you don't have a workforce that represents you, and here I'm talking about brown, black, Native Americans, there's going to be a mismatch in terms of, they call it patient-provider concordance, right? So if there's not that match, then where's the trust, right? So that's a big issue. But getting back to the Office of Minority Health in my previous work, we developed class standards, cultural and linguistically appropriate services and care. And those were like standards that kind of laid out the foundation to deliver healthcare with, appropriate kind of cultural kind of nuances, language access, etc. That in fact help increase access to those limited English-speaking patients. And obviously a lot of Latinos and also a lot of Asian Americans, first generation that came over from Vietnam or, you name those Asian countries. So that was a strong pillar. But also the importance of outreach. How do you outreach to Latinos? Now with the evolution of social media platforms, that's another kind of opportunity that we can maximize. And in fact, based on a Pew, I think, Foundation study, Latinos have a very high rate of participation in social media kind of platforms. So that's a strategy I think that can be utilized to increase awareness in terms of health promotion, disease prevention, or just being knowledgeable about health conditions that affect our people. So.
Thank you.
Can I add something to it? So one of the things, I'm glad you mentioned this, like I said, I can talk a lot, but one of the things we are doing right now is we have some mobile units that are in locations where there are less well represented patients in clinical trials. And I know trust was a word you used. Trust is incredibly important in gaining people's ability to listen and trust you in what you're recommending. So what we've done, we have 2 buses, and I'm talking like Greyhound-sized buses. They're equipped with 3 exam rooms where patients can come in for health screenings. So to your point, they may not know they have a disease. So we'll go out there, we're actually in San Antonio right now, and in Los Angeles to try to capture people in the communities where we can do their health screenings if they are appropriate and interested and trusting that they could also be part of clinical trials. Because what the FDA has mandated, what we all should be doing anyway, is making sure that our trials of new drugs and therapies reflect the population that we're serving. But if people don't have trust to be part of a trial, it's going to be very, very hard to do that. So our vision was to go into the communities where they are with the help of faith-based, other community leaders and community partners to really help to encourage people to be a part of the process, to make sure that a drug that is approved in this country actually applies to them, because we all have genetic and other differences, other social determinants of health. All of those things are critically important and really do want to make sure that we are maximizing everyone's involvement.
I just wanted to add a couple of other footnotes in terms of clinical trials. Latinos, just like other minority populations, are severely underrepresented in clinical trials. And that's a patient perspective. And then you look at investigators. So again, it goes back to that concordance thing. If you don't have researchers or investigators that look like you, that represent the community, it's going to be very difficult to gain that trust. So that's something that at NHHF we're looking at. How can we increase the representation of more clinical investigators, research investigators in clinical trials, in addition to getting more patients to be part of the process? Because it's important that those therapeutics that are being developed actually represent their genetic makeup.
Absolutely.
Thank you. This is all wonderful, and I think that Jonathan probably has more to add as well. And maybe you can share a little bit about what your organization has been working on for the last few years.
So we've been looking at oral health as an essential component to health, right? You look at 90% of systemic diseases that have a tendency or a characteristic that manifests in the mouth, right? And so when you recognize that there are so many conditions, right? You think diabetes, periodontal disease, the list goes on. There's a lot of things that your mouth can tell you. A happy mouth is a happy smile, right? And when you have in the United States 46% of people age 30 and up developing some form of gum disease, when you have kids missing about 34 million school hours in a year, and roughly about 46 billion in lost productivity from parents or adults in general, you've got a problem, right? And I think part of the issue is that in dental care in the United States is fragmented, right? There's a lot of in and outs. There's a lot of different ways for you to access care, and not all of it works. And so, preventive care works. We know that it does, and we're huge advocates of that. We know that a diabetic patient can save about $574 a year just having preventive care. And so we proudly supported HHS and CMS's rulemaking on making sure that you've got Medicare covering essential dental services if and when it's appropriate to address an underlying condition. We also were one of the industry partners when it came to making sure that states have the flexibility of adding dental care to marketplace healthcare plans. Really, it's more about making sure that, again, we can do, Cincinnati could be there for you at the aisle, but it's got to be it's got to be done in consultation with your dentist, right? Like if you've got pain, how do we help you resolve your pain? And part of our mission has been to not only just meet you at the aisle at your favorite pharmacy or your supermarket, it's also about really thinking about how to proactively tell lawmakers and rulemakers, okay, there are some issues here. This is where we can have some private and public sector collaboration. And we really do think that there's, like I said before, a lot of work to do on dental care. And most people don't think twice, right? Oh, I have bleeding gums. Okay, that's not a good thing, right? And it takes a lot of time to get, sometimes for patients to realize, oh, I've got a problem. And we really want to be able to address those issues before they become chronic or develop into other more serious conditions that generate a problem in the healthcare system. We also know that over-the-counter products have a generated savings for the healthcare system. For every dollar you spend on an over-the-counter product, you generate $7 in savings to the healthcare system. Whether that's making sure that you're not going to the emergency room for a condition that could have been easily prevented, or even non-traumatic dental conditions. And I think that one in particular is interesting because if you look at the 2014 study from the NIH, you had roughly about 2.4 million ER visits for non-traumatic dental issues. So like about 2/3. So I've got a cavity that really needs a root canal, but my only option now is to extract it. Medicaid only covers about 40% of those adults and about 70% of kids. So you have a gap there that we're not meeting. And so, we, for example, are big fans of making sure that items like toothpaste are, should be tax-free for HSA and FSA purposes. Because again, it's about thinking about those patients that might not qualify for those programs and still have to pay out of pocket for something else. And, equity manifests in different ways. things, right? What one patient might afford, someone might not. So how do we make sure that at least we have some level playing field, at least in dental care? And so it's been a big emphasis for us thinking about other ways, and we do think FSAs and HSAs are a way to meet, especially those working class families that don't qualify for these other safety net services.
Thank you. And so I want to come back to Dr. Carson. You mentioned the social determinants of health, and would love to hear maybe how you think that impacts the Hispanic community, or how does that present in the Hispanic community?
Yeah. So I'm just going to share a few statistics first, just to help you understand. So in this country, about 7.7% of the population, or 25 million people, have asthma. Among those people with asthma, about 5% are what we consider severe. So people who are having what we call exacerbations, worsening of their underlying disease that might require them to use their inhaler more, get put on steroids, as I mentioned. And so that severe asthma does take up a lot of healthcare utilization. But in terms of the populations, we know that non-Hispanic Blacks are much more impacted than non-Hispanic whites. We also know that non-Hispanic whites are more impacted than Hispanics. And then you'll say, well, why are you sitting here in front of us and telling me this? Well, when you look in the Hispanic population, the Puerto Rican population is 2 times more likely to have an asthma attack than their non-Puerto Rican Hispanic colleagues, and 3 times higher related asthma deaths. So we talk about things being different. With this is probably somewhat genetic, but it may also be related to access. It may be related to what we call social determinants of health. So what does that mean? It's your employment status. It's your home environment. It's your work. Are you able to get off of work to even go and see someone? So there are so many things, and it's a grab bag. But the bottom line is that all of these things all contribute, and so it can't be understated. It's not one thing. It's usually a collective. And when you start to see unique differences within populations, it really does put the onus on us as clinicians to drill down and see what can we do differently. Is it about awareness? Is it about not having access to those regular medications, or your clinician not knowing that you're not well controlled? So, think about it. You go to a clinician who may not be aware, and they don't speak your language. How are they going to know whether you're controlled or not? I already confessed I don't speak Spanish, but that's because I'm Canadian and I do speak French. But anyway, but the point is that, we need to do better at making sure that when people have other issues that we can't control, that we can control and be prepared and able to address their needs. So one of the things we did, and I'll tell you this as a clinician, we have every disease area has a control test to see how well controlled someone is. Do I need to make a difference in their medication regimen, for example, or talk about their inhalers? Are they using them properly? All of those things. So we developed with over 200 clinicians a tool to understand at a very easy, low literacy level, yes, no, if you have uncontrolled disease, and also questions in there that can help predict your likelihood of having an exacerbation. And we have developed it in 14 languages. So it's a simple yes, no. We obviously have it in Spanish, and again, 14 languages, so that it's a tool that people can use, give to a patient. You do or you don't. It's a binary, right? You do or you don't have this or that, and really helps to guide what needs to be done next, and then address what are the issues. Is it your home environment? Is it the allergens? Is it that you don't have filters? Like, what is it that we need to do differently? So again, you have to kind of ratchet back and say, okay, when this person is in front of me, because of our community solutions have helped to bring them in, then how do we then best take care of them? And you have to meet people where they are. You have to have the trust, and you have to speak the same language. So I think that, it's probably a long answer to that, but again, just looking at different ways that we can, help people recognize and then manage them.
That's fantastic. Yeah, actually, the next one is going to go to Guadalupe. To dovetail on this, and I know that we're talking a lot about the importance of diversity in the workforce. So I'd love to hear from your perspective, or the Hispanic Health Foundation, if there are any initiatives they're working on there.
Can I just piggyback on some of her comments?
Of course.
Because I think they're right on. Like I said, I have 3 children, two boys and a daughter. I remember my wife and I taking both of our children, not at the same time, to Children's Hospital, right around the corner. Asthma, they had asthma attacks, right? And every time we went in, there was another family from Anacostia, across the river. Right? And the physician would say, you need to get a nebulizer to the other family. They told us the same thing. We got a nebulizer. And that reduced the visitations because of asthma attacks of our 2 children. Yet, sometimes we'll go back and that family, same family, they did not have access or the means to get a nebulizer. Right? Secondly, they did not have a primary care provider that could follow up on his or her asthma condition, right? Plus medications. Right? So it's complex. So when you talk about social determinants of health, it's where you live does matter. It does matter if you have a primary care provider. It does matter if you have an environment, a housing environment that's not environmentally safe in terms of pollutants. Even though we live in a house that's 100 years old now, there are pollutants in those houses because they're old. But it's complex. It's not as easy as people think. And also educational systems. How are the school systems involved in terms of looking at children who have asthma across the river, but also on this side of the river? And getting back to health professions.
Workforce diversity.
Workforce diversity. Well, first of all, there's about 65, close to 64, 65 million Latinos in this country. Right? Yet, you look at physicians, we only represent 6%. Total, discord. I mean, it's the total, what do you call it, employment divide or profession inequity, right? Nurses, registered nurses, 80% of registered nurses are Caucasian. Latinas maybe represent, depending on what data you're looking at, between 5.4 and 6.7%. Because when they collect the data, there's a lot of Filipinas that have Spanish surnames, so the numbers are, they're not correct, right? So we have a lot of work, in terms of increasing the representation of health professions in general. At NHHF, we have a 5-year grant from the Centers for Disease Control to develop a program that can help increase the representation of Blacks, Latinos, and Native Americans in the public health workforce. And I think COVID was a driving force of that, because there was not enough representation of our people, but also so-called trusted messengers, right? And now they're realizing, hey, if we have another epidemic, even though we know that COVID has not died, it's still around. We need to have representation for those communities that can be used as trusted messengers, that can be used in terms of telling public health leadership or managers what's the best strategies, tactics to use to reach our communities, to make sure they get vaccinated, and make sure they practice, let's say, social distancing, make sure that they get, they have a primary care provider, et cetera, et cetera. So, we're working aggressively to develop, the tools that can be disseminated to these public health, to public health leadership and other folks, so they can no longer be excuses that we don't know how to do it. We're giving you at least some tools that you can adapt to your respective community, so you can do the right appropriate outreach, you can develop the right kind of interventions, clinical, health promotion, disease prevention interventions that can have an impact on not only the Latino community, but also other communities who are not represented equally or do not have equal access to health care and also public health services.
Thank you, Brother. Okay, Jonathan, next. So there's a theme here, right? And so what are some of the observations you've seen or the trends you've seen across the country that prevent people from living healthy lives?
So I think we've addressed some of these, right? And I think my colleagues here have done a really great job of what I call making it real, right? Where there are serious shortcomings in our system, whether it's not being able to access a nebulizer, whether it's not having the right insurance plan or not being insured, period, right? There are a lot of shortcomings that we have there. I think the biggest trend, and I go back to the figure I mentioned earlier, with the US having the highest expenditure and yet somehow being 11th or ranked 11th when it comes to health inclusivity, right? And being able to meet patients where they're at. And if you haven't had a chance, or if this is the first time you're hearing about this metric from The Economist, I think it's a great tool to look at, because a lot of times we think of healthcare in a bubble, right? That, you know, if it doesn't work, let's come up with a new solution that's very, you know, cut and dry, right? And I think the index really tries to, you know, find those best practices, you know, from other countries that are, you know, doing okay or those that struggle, right? And really trying to make the point that there are details that we can learn from. And so I think that particular point stuck with me, because again, when we talk about efficiency, when we talk about finding ways to maximize the benefits on Medicare plans, or whether or not we should, you know, add additional products to HSAs and FSAs, right? There is a world there that we can, you know, a wealth of knowledge that we can pull from there. And, you know, the other trend, I have to tell you, look, preventive care is powerful, right? I think those of us who are in the space, and I shared a statistic with you, right? You know, someone with diabetes saving $574 on dental care. You look at patients with coronary artery disease, right? Just by, you know, giving people the ability to empower themselves with the right dental tools, right? Can save about $675 a year. And so there's a lot there that we can do. I feel that dental care is something we might take for granted. We go to the dentist every 6 months. Mira, estoy bien. Okay, y así lo dejamos, ¿verdad? But there's a lot more to that, right? And what if you have these bleeding gums that keep on coming up every 6 months? You know, or, you know, when was the last time a dentist used the periodontal tool to find out your pockets? And what I mean by that is the tool that they use to figure out how deep of a pocket you have, where you can, you know, develop gingivitis and ultimately periodontal disease. A lot of times we don't think about that. And really also making sure that, you know, federally qualified health centers are part of those conversations. And so, again, I think looking at that one figure, and again, I'm a huge advocate of folks looking up that index with The Economist, because there's so much that we can pull from and thinking creatively about solutions, right? I think the question isn't really, in my opinion, so much about, you know, what other items can be added. It's more about what can we do to maximize the current resource, especially when you have, you know, constraints, right? A federally qualified health center can only do so much. How do we fortify what they've got using existing resources and adding where necessary? And I think there's a lot of opportunity there, right? It's not just about, you know, creating that one-time feel-good. It's about making sure that the dental care system meets your needs where you're at. And if you're like me, who also has the bleeding gum problem, well, okay, how do I solve it? How do I empower myself? How do I recognize which tools and which products are right for me, right? And that's where I think we've got some work to do.
Yeah, great. And so we've been talking a lot about like the social determinants of health, and so maybe let's talk a little bit about systems and policy solutions here. So let's shift. I think, Guadalupe, maybe you can tell us a little bit maybe about the role of community engagement in developing health policies and programs for Latinos.
Sure. I think Jonathan made an excellent point about federally qualified health centers. We have maybe 1,400 plus federally qualified health centers, and those are like key trusted community health centers that have a connection with our respective communities. So they're very powerful in engaging patients. They have mobile kind of clinic, vehicles that do outreach, that do health fairs, that also, but even internally, you know, the one, I used to be, as a matter of fact, chairman of the Federally Qualified Health Center here in DC called Mary Center. And so bilingual staff is critical, right? Folks that represent the community, because they're outreach workers, they're promotoras de salud, you know, community health workers that are the broker or the linkage to those communities, to engage those communities. And it's so especially it's so important to engage the patients, the consumers, because we always think that we have the best answers from the top. We don't. I mean, they deal with day-to-day issues that are complex. You know, we may deliver, you know, certain kind of health care, but then there's also mental health kind of issues. There's also substance abuse issues. There's housing abuse issues. There's economic kind of issues. So it's really important that we engage the community, really find out what are the root problems in terms of healthcare, in terms of how can we better understand their situation and develop the right kind of interventions that can improve their well-being. But how do we use existing resources to do that? And not limit it just, let's say, to federally qualified health centers, but maybe other entities that play a role in looking at that patient from a more holistic kind of perspective.
Yeah, thank you. And so, Carson, do you think that you'd like to expound on some of the wonderful things AstraZeneca's been doing in the Latino community?
Yeah, so I think I've shared many of them, you know, with the Air Mobile Unit, for example. It's not just that, but again, you talked about having investigators, for example, in clinical trials who look like the patients that we're trying to recruit or need to recruit into the study. So we do have programs that help people know what it takes and help them to resource being a clinical trial site. And so, you know, we recognize, and it's really, I mean, I learned this myself when I was in practice. If a patient who looked like me came to me and I thought they were a candidate for a trial versus my colleague who was an older Caucasian male, that they would much more likely say yes to me because of this, you know, increased trust. So again, one of the ways we're doing that is to try to improve that trust in the communities. I've mentioned, you know, having tools available to the clinicians anywhere, in any clinic, and we have data that shows when this tool called the AirQ is utilized in any health system or clinic or, you know, in someone's practice, that their outcomes actually go down, meaning bad outcomes go down. So having fewer exacerbations, better control, because to your point, yes, you can get a nebulizer, but isn't it better to not have the exacerbation that requires the trip to the ER, that people are afraid to go to, they don't have a copay, they can't take time off of work, they suffer, and then we suffer with bad outcomes. So I think, you know, you have to really go backwards and see where's the root, and how can we get to overall better understanding, better care, better involvement. And so your community outreach that you referred to, and both of you have referred to, are critical. It's part of building that trust. It's part of then allowing people to get access. And there's more access than people realize they have. I was part of a study looking at, I mean, I work on a biologic treatment for patients with severe asthma, and it's commercially available, obviously, but Medicaid is also covers it completely. But yet, when we looked at our real world evidence, many patients are still not even getting it because their clinicians just assume, again, what do we talk about when we assume? People just don't think about it. There's this unconscious bias that, oh, you have severe asthma, you have, you know, you won't have access because you're Medicaid. Well, they need to know. And so we really have to make sure that on many levels, people know what resources are available to them. And that's part of that patient centricity. We need to arm our patients to tell them, well, yeah, you have severe asthma, but you're getting X number of courses of steroids. You get over 1,000 milligrams of steroids, and your risk for the diseases that are more prevalent in the Hispanic and Black communities: obesity, hypertension, diabetes, cardiovascular disease. So all of those things are fed and worsened by being on the cheapest alternative and not the opportunity to be on medicines that can really change outcome. So, we have many programs. I can't personally speak to them because I don't know the detail of it, but I can tell you there's AZ and Me, I believe it's called, where they can get, because I've used this for my patients in the past, access to medications, by filling out forms. We have help with people getting on biologics, helping the clinics get through the paperwork and help them know what they need to do to be able to get patients on these types of therapies that are available and are really making a huge difference in outcome, so that you don't have to go to the ER, that you don't have to take time off of work, and you can actually have a full and full life.
Thank you. And so, Jonathan, let's turn to you to hear your perspective on what are some of the policy solutions that you're advocating for at the federal level or state level that will help improve Latino health outcomes.
Both are important. I think the federal ones are more fun, but states will do what they do, right? It's very interesting to see how states over the last few years have become a lot more active in a lot of healthcare related issues. You look at places like Maryland and Florida that made dental products tax-free over the last 2 years, and you'll see a constant stream of states that want to empower their local their populations, and by doing it in a way where there are certain benefits if you're here, so like the tax-free item, for example, and really trying to divert resources. And so it's interesting to see how this will pan out as we go into a new administration moving forward. I think two takeaways for me on the federal side, since I'm a federal dude on the toothpaste side, two things. Most people don't know that toothpaste under tax rules are considered toiletries. In other words, there's no real, at least in the IRS's view, real purpose other than, cosmetic. It makes you look and feel good, right? But toothpaste has evolved a lot. And what I mean by a lot is that the IRS depends on the definition from 1957. So we haven't updated that since. So your pearly whites, you're doing it, with trusted ingredients. Those ingredients have evolved over time. So IRS should probably take a look at that and think about, all the new stuff that's come, over the counter to help patients meet some of their needs, whether that's combating periodontal disease. It's not just about cavity prevention anymore. There's a lot more to do, and a lot more products that are approved by FDA for those purposes. I think the second thing, and this is a central theme that I think some of us are targeting, but in different ways. The emergency room isn't a treatment plan, and that goes across the board for dental care and other avenues. But really, we need to do better for our patients. We need to do better for the citizens of the country and those that rely on the healthcare system that exists in their respective jurisdictions. And again, when you're looking at programs that, again, thinking about Medicaid, right? The example that I brought up earlier, where it's 1.6 billion in charges, we can do better, right? And part of it is making sure that you've got the appropriate physicians in place, that you have the right infrastructure that meets patients where they're at, and where applicable. That's when some of us come in. Some of the medications that are safe and effective and can be used in an over-the-counter fashion, helping meet patients there too. So there's a lot that we can do. I think a lot of people also think it's interesting that, at least when it comes to over-the-counter products, you've got more choices in Europe and Canada than you do here. And so a lot of people think about like the sunscreen issue, right? Because it's like, why is it that in France you can buy all these cool products and not here, right? It's a thing. And so looking at those models and trying to figure out where we can meet patients better increasing that innovation here in the US and making sure that, again, making sure that we deliver that everyday health with humanity. That's a core component for us, and a lot of it is making sure that those innovations make it to consumers, making sure that people have access to those products in a way that is affordable and accessible to them. And look, I mean, I don't have to tell, you know, I'm sure your Dia or Dio somewhere has said, oh, this is my favorite toothpaste, right? We do make that effort of making sure that we meet our patients where they're at, regardless of zip code, through our partners. And so, really, those are my two tidbits. Let's update that tax definition of toothpaste, because wow, it's changed a lot since. I think 57 was what, probably the Soviet fix. And really, again, looking at transitioning people away from the ER for preventable dental care. We can do better. We have the infrastructure. We just have to find that secret sauce, how we put it together.
Thank you. Let's work back this way. Guadalupe, would you like to put down on some policy solutions? You think that
I wholeheartedly support Jonathan's position on dental care. The thing about, and that is a big gap. I can tell you personally, from a family perspective, I have Medicare, which doesn't pay anything in terms of dental care. So I have midlife, which pays a little bit. So here, we're talking about two families who are employed, that's two members of the family. So if you look at low-income folks, they do not have access to dental, which is horrible. I mean, because, you know, whatever you eat, you know, and your teeth and everything, it's a critical component of your body. And I think one policy recommendation would be how physicians can really look at oral health as part of their primary care consultations. Because when I go to the physician, he or she never talk about oral health. But I have a dentist, and he knows as much about even like COVID and all these other diseases that my primary care physician knows about. The importance of getting oral health. And it's a missing piece, I think, in our service delivery system, which needs to be addressed. But we're going to go through a major transition, because of the new administration, so we don't know what the agenda is going to be, because they're talking about cutting back Medicare, Medicaid, so it's going to be a challenge, but I think with challenges, opportunities do arise, and how do we maximize those opportunities? Legislation in terms of workforce is critical. I mean, the demographics are changing so much, and we're not keeping up with the changing demographics in terms of having a public health or healthcare workforce that represents those demographic changes. So reauthorization legislation, either HRSA, which is responsible for a lot of these workforce kind of programs, is critical. And that's something that we, NHHF, and maybe other national Latino organizations can support reauthorization legislation that really supports increasing not only Latinos, but Blacks and Native Americans especially into the workforce, because we hardly ever mention Native Americans, but it's really rough for them. I can tell from a personal perspective. The Navajo Nation is horrible. So, and they were devastated by COVID. A lot of the folks from the Navajo reservation, died because of COVID. So.
Thank you. And now back to Dr. Parsons. And so you, as a trained pulmonologist, definitely have an experience to talk about. What are you most excited about for the future?
So you've heard me mention the word steroid repeatedly. And I will tell you that as a physician, one of the things as a pulmonary physician, one of the things I hated was having to prescribe prednisone, steroids. It's what we have to use because it does work. But what I'm excited about is that honestly, over the past 15 years, 10 to 15 years, the innovation within respiratory disease with products that we can use to target reducing steroid exposure, reducing exacerbations, which ultimately lead to steroid exposure, is just phenomenal. And I personally had, was presented from our research and development team multiple new products that are in development that are really geared to trying to overall improve pulmonary health, not just asthma, COPD, lung cancer. I mean, it's just a huge portfolio. And so I'm very proud to be part of a company and industry that is really putting great effort into improving respiratory health. Because again, it's all circular, right? I've talked a bit about our carbon emissions reduction. Well, air quality is one of the biggest issues for having good respiratory health. So you can't treat with a Band-Aid if you don't look at the the overall problem. So again, what AstraZeneca is doing, both with the innovation in terms of products, clinical trials, expanding our trials to people who really need to be included and managed, but also looking at from a top level down, that making a difference with the environment is huge. So.
Yeah, thank you. So I want to open up the panelists to the audience. If you have any questions, I believe we have someone in the audience with a microphone who's able to come through the room if you have any questions, and then we'll ask that you speak into the microphone. You introduce yourself, your name, organization, or affiliation, and then ask your question. So in the interim, as people start to think about a question, maybe you've had one, are there any questions so far? Okay, great, we have one here.
Go ahead.
Hi guys, I'm Chris. I'm a global leader. And I guess during high school, I volunteered at a free clinic where we helped a lot of the undocumented population. So I was wondering if you guys are doing anything to focus on that population.
I mean, I would say that we offer our products to free clinics and obviously help to, I'm not a pricing person, so don't ask me about cost issues, but certainly do have many programs to try to get drugs medications to patients who are in need. So free clinics are certainly one of the places that we do provide. But again, I think it's more than just the medication, it's the informing of the community of where there's a problem. So if you don't know you have a problem, you won't seek help. And so I think it's really important that the education, we work with the community, with the primary care. And actually right now, primary care physicians or practitioners are mostly not doctors. It's mostly MPs and PAs, and they are overloaded. It's a very challenging, and I know you could probably both speak to this. So again, education is key. Education in the community and education in the healthcare providers to make sure that they are aware, and then they can give the products that can help the patients.
So NHHF works closely with other Latino organizations that advocate on the behalf of undocumented individuals in terms of accessing healthcare. For example, federally qualified health centers, they don't make it a requirement that you be a citizen. They don't ask, they're not supposed to ask that question. So if you're undocumented, and I personally even, run into individuals who are undocumented and they tell me about their health kind of condition, I tell them go to this center because at least you have some access to care. Because if they wait, then it may be too late when they seek treatment, even for dental care. I mean, about 5 or 6 years ago, we had an African American child that had abscess and then wasn't treated and he died. So it's like we advocate and work with other national and local kind of community-based health clinics, federally qualified health centers, to help or to promote the importance of having access, of them providing health care to undocumented individuals. So it's a big issue. It's going to be a big challenge, even more, in the coming months. months and years.
And then I'll just add on from Haley's perspective, the beauty of us being over the counter, hey, everyone buys us, right? We are on the front lines, we know, and we do have a lot of undocumented customers because sometimes we are their healthcare, right? Right off the bat. And so we do partner where applicable, where we can make an impact. So we recently worked with the Biden administration on their cancer boost shot initiative, right? Making sure that products like NRT, right, tobacco cessation products, were made available to them. And so we try to find creative ways because we know that some products can be a little bit more out of reach, and we try to find ways to create those partnerships with the administration and appropriate agencies to make sure they get to where they gotta go.
Yes, another question from the audience?
Emmanuel Rosales, I'm with the Job Creators Network. I have a question and a suggestion. One of the things that are out there that can assist, particularly the small business community, and you know the Hispanic small business is growing very largely, and they employ a lot of Hispanics, is an association helpline. Where actually the small business, by joining an association like a Chamber of Commerce, a Hispanic Chamber or a regular chamber or another association, can have access then to that land, which would be cheaper because of the depth of the association. And then they could provide those services also to their employees. And that's something that we've been advocating for a long time, because that is definitely could be a lifesaver, especially for the working class, the teams out there that really would have access to their employers.
Anyone?
No, personally, I totally agree with that because there's a lot of Latino folks that work for contractors, and that's a big market. You look at it from a market kind of perspective, and they do need health care because sometimes they get injured or something happens and they don't know where to go. I think that would be more cost effective, efficient, etc. So I'm with you on that.
Great, we have another question in the back.
Good morning, hi everybody, my name is Monica Seabury, and this question is more for, I know you mentioned a little bit about the programs that you have in different states and cities, but to understand more the collaboration with local governments, specifically with serving new communities. I give an example of New York City, to address the first question about immigrants and undocumented immigrants. There is a growing population of immigrants that are mothers and have kids. In the case of New York City, in Chicago recently, selling candy in the subway, selling candy in the streets, and not getting access to good quality public health. So I'm wondering if there are any local partnerships specifically with local governments, and if you're thinking, especially with this new administration coming in, of expanding those programs in the states or creating new programs.
I think that's for you.
No, well, again, in HHF, we're again, we focus on leadership, education, and research. Right? Education is key, but also how do we collaborate with other organizations that can make the connections with those communities who don't have the power, or let's say they're afraid of being deported, so they have limited access to employment because they're not documented, right? So how do we work with immigrant kind of societies, advocacy societies? And that's when we get calls, we try to make those connections. We try to support, even here in DC. We also have I wouldn't say very large, but we do have a number of individuals who are undocumented, and sometimes we get calls and they don't know the answer. So they're seeking basic housing kind of needs or opportunities to work as house cleaners or whatever, because we have an office. They call us up, say, do you need somebody to clean your office? But we try to make the connections with other community-based organizations that can provide those kind of support. At least here at the local level, we're a national organization, so sometimes we don't have those connections. But I live in the city. I've been here since 1980, so I know a lot of community-based organizations, another colleague that's been around for a while. So we try to, it's about networking. It's about making the connections and trying to help our respective communities when they need help. So.
Okay, see more questions. Why don't we start in the back, there in the corner, and then move our way up? Yeah, that's you.
Hi, my name is Shlep. My company is Creative Alliance Communications, and I also work with the National Hispanic Health Foundation. My question is, first of all, your talent has been superb. I usually get, after all these years, like, thumbs up, yeah. It was excellent. But now, if not today, when? Because now I've got decades of work with community health. I thought rheumatoid was going to make a difference. I've seen dental issues in Puerto Rico become death sentences. I've been a patient, and last year my doctor said, are you here as an advocate or as a patient? If you're not an advocate for yourself, but in the community, and I've been in New York, California, Texas, here in DC, and I work so hard on COVID issues throughout the country. If people don't speak, believe that they have a voice. So what do we do? Because the idea is great, but how do we make it real and make it, how do we make change?
I could just say on a personal philosophical level that I think the empowering patients is really critical. I deal with this because my own parents don't, they have a physician in the family. They don't ask me. They just assume everything's fine. Anyway, that's another discussion for another time. But I think, patients need to be able and be resourced to know, as I said, when there is a problem. So we have a big role in terms of just we as clinicians to make sure that patients understand, when is this normal? What is normal? When, women especially are more likely to say, oh, I'm just short of breath because I've gained weight, or I'm out of shape and I'm not going to the gym, blah, blah, blah. Well, no, we need to make sure people understand what is normal and what's not. Because more often than not, when women do go, the word hysteria comes from the Greek word for uterus. So hysteria is a woman issue. So when women go to the physician and say, I think I'm short of breath, I'm dying, blah, 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 it's more often brushed off as anxiety. So I can tell you a very bad condition called pulmonary hypertension, where particularly impacts women. More often than not, they are found at a later stage because they have been told they're anxious and don't have the appropriate testing. So again, patients being educated, aware, how do we do that with health screenings, with getting out in the community, is really critically important for people to understand what's normal and what's not, so they can then advocate for themselves. So, a lot of what we do with patient advocacy programs is to really get out there and educate on what is normal, what's not, and what's available to them. So I would say that that's my answer in terms of how we can empower. And it's not just for asthma, obviously. Lung cancer is huge. People are afraid to do lung cancer screenings. They're eligible. They don't do it because, one, they're afraid of what they might find. Well, do you know that when we find an early stage lung cancer, that reduction in mortality from lung cancer is 20-fold. So fear of doing a test that's going to actually make your outcome much better doesn't make sense. So we have to, again, make people more aware about the importance of screening, about the importance of advocating for themselves. So I do think I could wax on forever, but I think there's many, many incidences of where we need to empower. And we also need our clinicians who are at the front line. I mentioned the majority are MPs, PAs. They also need to be well versed in what's important and what should be done for screening. Because even though it's available, I think 15% of the population who's eligible actually gets screened. That's ridiculous when they're eligible. So again, a lot to be done in improving awareness on both the clinicians and the patient side.
If we learned anything about COVID, was the importance of raising the awareness of the impact COVID had on our families. I mean, we've lost so many folks because of COVID. Young, middle-aged, elderly folks, etc. And one of the major issues there was trust, or misinformation. So how do we, deal with that misinformation? How do we build trust? And there's all these coalitions now that are coming up. I mean, they're evolving because they're using COVID as a way to leverage, the good work that they did to combat COVID. There's a new coalition, it's called Coalition for Trust and Science. Okay. And the importance of how do we increase trust? How do we deal with misinformation? That information which has, I think, killed a lot of our folks because they did not get vaccinated. They believed that, it was made up by the government, etc. So I think it's important that, we look at coalitions that are out there that can support in terms of raising awareness about health disparities, about COVID, etc., etc. I think they're out there, and because of the technology that we have now, social media platforms, it makes it easier to connect with folks, to build a community that can help us, deal with these complex health issues. That's just my recommendation.
I think you've had a wonderful answer articulated by both my colleagues, and the reality here is that the M word, right? Misinformation about claims, misinformation about, what a product can do or what an outcome is going to be. We have to really work in tandem with patient advocacy groups. There's no way out of this one, because we want those trusted faces. We want people to, really make sure that we have the right people, pushing the correct narratives on what a product can do, what it isn't going to do, and really, that's it, right? Like, it's just having that private, public-private partnership where applicable. But again, the misinformation piece, I think we look at, because again, we want to make sure a person understands what a product is intended for and what it isn't.
Thank you. We have 2 more questions. Ms. Red?
Yeah, thank you so much. First off, thank you all so much for taking the time to speak to us. Health is wealth for everyone, so I really appreciate it. It's an important topic. My question pertained to, I was really grateful to hear oral hygiene and dental work brought up, because that goes into preventative health, and I feel like another thing that's been a big conversation with preventative health is nutrition and food, and that goes into every health issue that we come across. So I was wondering, within your respective organizations, if there's been any conversation surrounding that, especially because it directly impacts underrepresented communities that goes into this conversation. So I'd love to hear if you guys have any thoughts on that.
So I could probably start with this one, because we are the manufacturers of Centrum. And one of the challenges we have in federal conversations is talking about nutrition as not just caloric intake, right? It's not just about how many calories did you eat today. It's did you meet your DV, requirements, right? And, especially if you look at, we talk a little bit about women's health in this conversation, but you look at conditions like spina bifida, right? Those are preventable with appropriate, nutrition and supplementation. And so there's a big space. I feel there's a big disconnect there with, what it should be and what the conversation is currently now. Happy to talk to you offline, because I could talk to you for days about nutrition, but I'll let my colleagues know.
So I had mentioned earlier the Community Solutions project that we have every year, funding over $1 million to community projects. I am one of the reviewers for those proposals that come in, and I will say that a majority of them are actually tailored to food and housing security, as well as to oral health, as well as other screening modalities. So we really, are helping to support that way by helping people have in their home communities ways to address all of those insecurities. So that's certainly one of the ones that pops up quite often.
I love food. Healthy food, good food. All you folks that are drinking this, not good. I'm serious.
Stay tuned.
I'm serious. The true story. I banned soft drinks in my household. Corn syrup. High
Mine's
fructose.
water, just so you know, it's water.
If you look, whenever you buy a product, always look at the labels. And if you see additives, don't go there. Right? Obesity is a big problem in the Latino community. It's about food. What we eat is who we are. At HHS recently, they have an initiative on food is health, right? Which is all true. Because whatever you consume in terms of junk food, McDonald's or Rogers, it's going to affect you. And I'm serious, it's going to, in terms of hypertension, in terms of obesity, etc., heart disease, you name it. So I think you hit it right on. Because we have to promote our, let's say, our roots in terms of what our parents used to eat, right? And because this country is all about processed foods, right? I cook a lot because I know what I'm cooking. I know what I'm adding to my dishes, right? To my meals. So it's important that you recognize that whenever you buy a product, make sure that there's no additives in those products. Secondly, you can change your dietary practice, but if you don't exercise, it's got to be together. It's got to be a joint kind of venture. But food is so critical in terms of who we are. This country has a bad obesity problem across the country, and it's not getting better. And if we don't address that, healthcare costs are going to continue to rise because we've got these new, what is it called, Ozempic or whatever, it's like, who's going to pay for it? We are. The Medicare is going to pay for it. And that's not right. Because if we address it from a prevention standpoint, we'll be better off. But it's all about the money, to say it. It's all about the money.
But you mentioned money, you realize that those healthy organic foods cost more.
Exactly.
And
But
so
except if you have your home gardens.
Right, well, not everybody has that luxury, but I think this is not me in my doctor outfit, it's me just saying, I think it's a real challenge, and I think label reading is very, very important, and something that some of these community programs have actually been addressing. Like, we need to teach people to read the labels, look at that sodium content. If it's 730 milligrams versus 150, go with the 150. We do oversalt. I happen to be married to a kidney guy, so he cares about sodium. So I had to learn this, or else I don't use salt in my food. But I think it's really important when you realize that the simplest of things that can really make a difference in changing outcome, hypertension, obesity, based on fat content, based on the types of fats, cholesterol is an issue. Like, all of these things have a common root, and I think it's really important, again, education. And it sounds simplistic to keep harping on that, but it's not, because it's at the root. You are what you eat, or you said it a different way, but it's the same concept, right? You have to know what you're putting in and what you're going to get out of it. So I think it's really, really important. Anyway.
Thank you. We have a question here in the front.
Yes. To kind of pivot for Dr. Carstens, I really liked the statistic that you mentioned about how Puerto Rican individuals are about 2.6 more likely to have severe asthma issues.
Yes.
And so I was curious if there are any other statistics that are similar about the Latino community, and then what AstraZeneca or any of these other organizations might potentially be doing to address these concerns.
Yeah. So as I mentioned, in the overall hierarchy, it's actually among Hispanics, it's lower than the rest of the U.S. Population. So interesting. But then within the Hispanic population, why is Puerto Rico differentially? And again, it comes back to the SDOH, the social determinants. There may be genetic components too. I will tell you that some of our programs, and I know the medical science liaison who is actually working in Puerto Rico. We've had some amazing progress with educating on use of this tool I mentioned, the AirQ. So really specifically targeting the population that needs to be aware that why are you differentially impacted? Is it because of access to medications? Is it because of environmental issues? So again, trying to educate the pulmonologists and allergists who are treating and on the front line. So, I mean, from the standpoint of trying to not overuse the steroids, to make sure they're using appropriate background medications and getting access to that. So that's the best way we can get in. And again, it really, boils back to the education. So yeah. So
I just wanted to add one more footnote to this doctor's excellent presentation and comments. The Puerto Rican, in terms of infant mortality, Puerto Rican women have a similar rate as Black women in terms of mortality. But you look at the Mexican American women, it's not as high. So, what's the causation of them having a higher, higher rates of mortality? Could be environmental, could be genetic, access to healthcare, family structure. So,
yeah, absolutely, multifactorial.
Great, well, that was all the time we had for questions, so I'd like to give the panelists one last opportunity to provide a closing statement, words of wisdom, and any parting words today to our audience.
Well, I just want to say thank you. Thank you for inviting us to be here, to share what we're doing, and yes, thank you.
Yeah. Secondly, again, thank you for being here, and you're the next generation. At least I'm going to pass on the baton. No, really, your leadership is so important, and we need young folks. Keep on hoping, keep on fighting for our communities, and I wish you all the best in your career paths.
Yeah, no, thank you. I mean, it's always a great opportunity for us to chat with you guys on the issues of the day, because maybe you have an idea that we haven't thought of. And it's always cool to just be able to share that with you guys. So really thank you guys for sharing your afternoon with us.
Thank you, and so thank you to panelists for showing up. Maybe we'll do a round of applause for them.
And you. So thank you again, including you. So another round of applause for everyone, including our moderator. I just wanted to end with a couple of things. So there were a couple of questions in terms of organizations and how to collaborate and who do you call and all of that good stuff. So that not everybody's calling Guadalupe in his office. But keep in mind that, that we talk about here, right, at the Congressional Hispanic Leadership Institute. So remember that when you're talking to people in the community, that the offices of their city council, their county supervisor, the congressional office, they all have constituent services, caseworkers, people whose job it is to help the community. So it's not just about, Googling what is the, the health clinic or what, like there's other resources. And so you'd be surprised how often the offices of the members of Congress get all kinds of phone calls. One, and they are very resourceful. Two, by calling their offices, you put them on notice that if they don't have a relationship with an organization in the community, that they need to go find one, and they do it, and they get back to you. So again, keep in mind it's not just a nonprofit or a coalition or a partner somewhere in the community. Don't forget about the elected officials. And that doesn't matter whether you voted for them or not. They're not going to ask you, and it doesn't matter whether what your status is. Take the time to connect the dots and ask people in different arenas. Somebody asked about, I think it was New York. There was a question or an organization. The Hispanic Federation in New York has a whole bunch of resources. They have access to clinics. They have access to others in the community, and through the network, as Guadalupe also mentioned. there may be somebody in a community organization that only provides one aspect of care or services, but they know who the other one is that provides the other resource. So always look for those other connections. The other is, I'm always amazed, it didn't come up, but it kind of did a little bit, that in the Latino community, at least my mom and dad, that no matter how many times I ask them, or that, we've got this little group chat with my family, my siblings, we all know when mom is getting her checkup, when dad's getting the flu shot, and we'll tell them in advance, and we'll call them and say, Mom, no se te olvide, do not forget to ask the doctor about this and this and that, right? And they won't ask. Because they just figure it's the doctor has my medical records, if I need to know something, they're gonna tell me, right? They're the worst advocates for themselves, right? Because they all say that the doctor's gonna tell me. Well, you know what? The doctor also has a long list of other patients, and you need to advocate for yourself. So I think one of the other things is, one, we're all role models here, and we are all in leadership positions. So one is, please be a model for good health. Please be a model of being a good advocate for yourself and for other people, and take that extra time to educate others, because it's not just about waiting to hear until they call you and they tell you that they have stage 4 of something, right? So at least in my world, I'm a little bit of a nag when it comes to health issues with mom and dad, and we're always, checking in on them. And where you live and what access you have, this did come up. There's a lot of access out there for a lot of us, whether we have the health insurance or not. It sometimes takes a few more phone calls. It does take to figure out where we need the care. And even if you don't have the insurance and you have to go to a clinic or another, a health fair, whatever it is to get that care, make sure that you're an advocate for yourself, or if somebody needs you, please go with them to be that advocate and to help them. All of us here know how to ask the questions, but we have a lot of people in our community and our families that don't feel comfortable asking for that extra help or for that extra information. And sometimes they really don't know. And so if you can take that extra time to ask. I grew up in a farm worker camp, and so our dental care was go pull the teeth, because we know these kids are not gonna come back. They don't have the care, and that has consequences for your health down the road, right? So again, please take the time to be advocates. I did want to ask Jonathan if you could share again, how do you get access to that index, or the one that you guys worked on with The Economist?
So we could do it one of two ways.
Okay.
I can send you the link. But really, if you just Google The Economist Health Inclusivity Index, you'll find it. It's going on its 3rd year now. So check it out.
Okay, so what I'm going to ask the panelists too is, after this, if you can please send to us any other links to any other resources, and then that way we can add that as well. We always do a recap of the discussion, so we can add that information in there. And so again, thank you everyone. Wishing you good health, even through the holidays. Behave. And thank you again for being here. Again, I always say that not everybody has an opportunity to be here. Not everyone has the opportunity to advocate. So please do your part in advocating not only for yourself, but our communities. Thank you and have a blessed day.